Welcome back to The Full View. Now, rolling blackouts are adding to the daily grind for many. And tonight we're focusing on healthcare workers confronted with sickness and death, all made worse by load shedding. Doctors have been sharing heartbreaking stories with the Maverick Citizen. We're joined by the editor, Mark Haywood, and we're also joined by the Deputy General Secretary of Union Denosa, Khaya Sodidi. Thank you both for being with us tonight. Mr. Sodidi, let me start with you. And before we look at the situation at hospitals, the stress on healthcare workers, I'd like to ask your comment. Did you see Limpopo MEC Popi Ramathuba scolding hospital managers, saying, why aren't they helping with the long lines? We've been asking our viewers tonight about that approach. Do you have an opinion on that?
Good evening, Francis and the viewers. Yes, we have noted what Limpopo MEC Dr. Popi has done, or scolding the staff in that hospital. As a result, Denosa at Limpopo province, they've issued a statement condemning the behavior of MEC. And if you remember, MEC has been making headlines in that province for all the wrong reasons, the way she's handling the matters at the hospital, and also how she's dealing with the staff, nursing staff at the hospital. So we have made a comment and condemning her conduct.
All right, so you condemn that behavior, although some of our viewers are saying, look, this reflects the frustration that we feel with managers not looking at the situation we've reported in the past of people being left on the floor, etc. We know that many public hospitals are plagued by huge lines. We can't ascertain full blame, but people are frustrated.
Yes, Francis, but you cannot, the blame surely cannot be put to the nursing staff. The blame is a systematic problem. It's an infrastructural problem. The issue of long queues, it starts with a gross shortage of staff, and then some of the not working equipment at the hospital. So surely that cannot be the problem of the nursing staff, but that goes squarely to the shoulders of the employer that are failing to provide the conducive working environment for nurses, and also provide all the necessary tools so that they can work, but most importantly, to provide enough staff so that they can be able to deal with all those long queues. That's not really a fault of the working people or personnel in the hospitals.
All right, Mr. Haywood, you've written an article recently, and I mean, I have heard from doctors that seizures have been done with flashlights, with phones. You've really spoken to a number of healthcare workers, a number of doctors, and the stories are heartbreaking about babies on oxygen and the power goes down for 10 hours. I think that was at Senswalo Hospital. What was hardest for you among these anecdotes?
Good evening, Francis. Yes, there's no doubt that continuous load shedding is having a very, very negative impact, both on people's health individually, but also on healthcare services. We spoke to a range of doctors and specialists, mostly from public health facilities, hospitals and clinics, including Tinswalo Hospital in Mpumalanga. And really the stories are heartbreaking. Doctors work under enormous pressure as it is, but load shedding is making it even more difficult for them to save lives, to treat people, to care for people. The doctors I spoke to, one of them told a horrible story about a woman who had had a miscarriage, and because there was no electricity, she had to be left bleeding for a long period of time. Another told stories about the difficulties of resuscitating children, keeping neonatal infants, tiny babies warm when the electricity goes down. And they said that there's no doubt that this is costing lives, that patients are losing their lives as a result of it. People are unable to keep medicines, essential medicines like insulin, refrigerated. people living post-COVID but needing oxygen are unable to maintain oxygen supplies at home. You would be surprised at just how many ways load shedding is impacting negatively on the state of health of people in our country.
And you've picked up on something. We've questioned health authorities before and asked what's the death toll, because hospitals can't always be exempt. We'll talk about that. But Mr. Haywood, you can confirm from the people you spoke to that lives are being lost because of the rolling blackouts.
There's absolutely no doubt that lives are being lost in the health system. Doctors said that to me categorically, that is the case. You know, they said it's difficult proving causality all of the time because there may be a number of factors involved. But, you know, they are working on the front lines and they are feeling the brunt of this, and they know what happens when a patient dies whose life could well have been saved. So, yes, it is. And I think it's something that needs much more careful monitoring and scrutiny by the health department. And it is also something, Francis, that needs government and Eskom to do everything they can to exempt health facilities from load shedding. You know, this one doctor from Tinswalo Hospital told me how the military base in the area in Hoedspruit is somehow exempted from load shedding, but the hospital is not exempted from load shedding. I mean, that just, you know, there's no sense to that type of situation.
Yeah.
So there's a lot that needs to be done.
All right, and we've looked at this before. The answer is that not all hospitals can be exempted yet because of infrastructure. They're embedded in the system, but we do have some that are off the grid. I think it's something we should follow. Mr. Sodidi, let's end with you. It's not only the toll on the patients, but the toll on the healthcare workers, and that's something that Mark's article picked up on. Are you hearing the same from your members, this incredible sense of helplessness and of course, adding to their own distress?
Of course, there's no doubt, Francis. Mark is correct. We've received a number of complaints and comments about how nurses are struggling to do their daily duties due to a stoppage or cut of power in their institutions. And we must say that as Denosa, we're very disappointed that at this stage, in fact, that all healthcare institutions were not exempted from load shedding from the beginning. We had to make noise last year that to make sure that institutions are exempted from load shedding. But it's disappointing that it's all about 70 institutions in the country, which is, if you look at total of public health institutions in the country, about 500. Only 70 has been exempted from load shedding. Now, we ask ourselves what happens to other institutions, and those are exempted. The bigger hospitals, the clinics, whereby the immunization is being kept supposed to be kept under cold chain. They suffer because their refrigerators are switched off. Then once the refrigerators are switched off, and then the efficacy of that medication, immunization, is no longer working, and therefore it means that that drug becomes a waste and should be disposed. So waste of millions of rands that are going to a dustbin because of this, and that also results to the closure of the hospitals of clinics, because the government is focusing on hospitals but is ignoring the clinics, which are rendering very important services, immunization, whereby cold chain is needed. So it is indeed frustrating. And then the morale of the nurses is very low because they see that they cannot render services, and then they see patients dying in front of them.
A good point. Even if all hospitals eventually are exempted, that's something that we are following. Clinics, pharmacies as well, dealing with medicines that need that cold chain. Thank you very much. We'll leave it there. That was Denosa Deputy General Secretary Khaya Sodidi and Maverick Citizen Editor Mark Haywood. And by the way, we have asked the Limpopo Health MEC for her response to that video that went viral. Denosa saying that they condemn the way in which she handled that. She is not available for comment tonight.